Welcome back to Sex and Space, where we explore sex across all of its infinite dimensions. Today, we're bringing you an interview I had with the great William Moore, founder of the AdvancedYOU Clinic and developer of PhalloFILL Male Girth Enhancement. Before we dive in, we need your support. We think it's that talking about sex is crucial, but it often leads to us being silenced on social media. This makes it harder for others to find us and suggests that sex isn't okay to discuss. But of course, it absolutely is. More knowledge means better outcomes for everyone. You can help change this by following the podcast and connecting with us on our socials via sexandspace.com. Now let's drop into my interview with William Moore, founder of the AdvancedYOU Clinic and a developer of PhalloFILL Male Girth Enhancement. We talk all things penis girth enhancement, from the reasons people seek his help and treatment, to the process of the procedure, to the effects and benefits, the impacts of pornography on male body image, and the future of biohacking your health. Let's get into it. William Moore, founder of AdvancedYOU and developer of PhalloFILL. I'd love to just, for the people that don't know, I guess, about AdvancedYOU and a little bit of history about yourself would be really great if you could just hook us up.
Yeah, so I left college and I was headed down the pathway of doing wellness. I did a bachelor's degree in sports medicine. I have a master's degree in clinical exercise physiology, and I always thought that I was going to make people feel better and live longer in the gym, and by prescribing exercise and doing stress tests with 12 lead EKGs and spirometry and all those sort of things, which I do a little bit of that now. But then I sort of found my way into the aesthetic industry in 2003, and I was one of the very first clinics in Dallas that opened up as a laser hair removal clinic. And from that, it became skin rejuvenation, and then we got Botox FDA cleared, and we got dermal fillers FDA cleared, and I started progressing a little bit faster in the industry. I became a trainer, and I began to have companies reach out to me to work for them and to promote their products. And before you know it, it's 2010, 7 years later, and the very first mention of girth enhancement came out, which is a procedure called the P-shot, which is platelet-rich plasma, if you're familiar with that, where we draw the patient's blood, we spin it down, we collect their own growth factors, and we inject it back into the penis, into the corpora cavernosum. And it's supposed to enhance sexual performance, which it does, enhance sensitivity if that's been lost because of maybe type 2 diabetes or some type of neuropathy that's occurring. And it was also promoted to be used for girth enhancement or to increase the size of your penis. And I found very quickly in 2010 that it did not do this. But I had sent out a newsletter to about 10,000 of my existing patients and had a huge response to it, and realized that there was a huge need for men that wanted to enhance the size of their penis, but nobody was talking about it. And so I did the P-shot for a bit, realized that it wasn't doing what I wanted it to do for the size enhancement, continued to promote it for performance enhancement. And through the course of the next few years, I began to see people come into my clinic wanting correction for bad girth enhancement that they had gotten outside the country. A lot of times they came from Mexico. I hate to say that, but I love Mexico. But there's a bordering country, and there's a lot of sort of under the table, I would say, girth enhancement with unapproved products happens there. And so we were having patients come in asking to use the P-shot to correct it. Well, it wasn't about to correct what had happened when these permanent silicone fillers have been injected into the penis. No. Yeah. But at least it made me start thinking about dermal fillers being used in the penis. Although what I was seeing was horrific. So fast forward 2, 3, 4 more years, I start to see hyaluronic acid dermal fillers, which are very safe, come through the clinic, but the procedure wasn't symmetrical and it wasn't undetectable. And it made it more girthy, and it may have satisfied the partner, but it definitely wasn't aesthetically appealing or pleasing. Okay. And so during COVID, when we were closed down during 2020, I started experimenting with my own way of doing girth enhancement using safe, FDA-cleared hyaluronic acid dermal fillers. And so I came up with a technique that has been worked on since then, but it was a technique that we were able to lay the hyaluronic acid dermal filler evenly. I was able to put it in some friends who volunteered their wankers to let me inject during COVID. And so I injected these friends of mine, and they all had really, really good results. They were all really happy. And so when we opened back up at minimal capacity in August, and then in September of 2020, I began to tell some male patients about it, and they began to have the procedure done. They were happy with it. And then eventually I'm putting this on my website, and all of a sudden I'm booming with people who want to come in the door and have my hyaluronic acid dermal filler procedure. And they're all really happy until December of 2020, maybe January of 2021. This is when it got cold in Dallas. And all of a sudden, all these happy patients who, the same situation, the patients have been happy in the fall, then all of a sudden they're unhappy in December and January because it got cold and their penises retracted. And much like an accordion, if you can think, it got cold, it shrunk up, and then we had lumps in our procedure. And I know that they were even when they left the office, but then over the course of whatever happened in the house or whatever, whenever it was colder, it retracted, and then it caused the dermal filler to migrate. So I started working on a post-care garment that could be worn after the procedure that would keep the penis compressed and elongated so that there wasn't retraction. And nobody had done this before. And so over the course of about 12 months, I was able to develop and design a medical grade silicone sleeve that is placed on top of the filler placed on top of the penis after the dermal filler has been injected. And it stays on for 3 weeks, and it offers compression and elongation so that the dermal filler stays where our providers injected. And so now we have a really, really good, undetectable, reliable. Now that we have this garment, it's reliable. We can count on it working, almost every time. Sometimes the patients don't follow our post-care protocol exactly like they're supposed to, and generally when they come back for a follow-up, I can look at them and tell, because I know the little idiosyncrasies of what happens to the penis whenever the patient's not following the post-care protocol. And so I kind of slap the wrist, and we can fix it, because the nice thing about hyaluronic acid dermal filler is that it's can be dissolved, or it can be corrected with a product called hyaluronidase, which is an enzyme that will dissolve and correct hyaluronic acid filler. So we never really have to worry about anything ugly that's not reversible happening with our procedure, which the other ones out there that advertise permanent results have to worry about this, because permanent result is a permanent migration if something happens. And if you form one of those lumps, there's no way to correct it whenever you're using something that's permanent. So people ask us the question about permanent versus semi-permanent, which we say that ours is semi-permanent, which lasts 3 to 4 years. And you never would want to choose something that is permanent in your body that you really can't reverse. So so the development of the post-care sleeve, which is where we are now, we just got our patent back, and it's being patented. We actually have it being patented over your way as well. I think we already got our Australian patent back. And so we're going to be patented all over the world for this post-care sleeve. And we're soon to start expanding. We're trying to start figuring out how we're going to expand this out of the country now that we can protect our sleeve.
Yeah, amazing. I think it's interesting that, obviously, this is something I imagine that people don't turn to lightly, and so there's a fair amount of reassurance in that fact that it is semi-permanent.
And you've only got one, and I know how much you like him, and you probably even have him named. So I know you only got one, and you can't mess him up.
Yeah. So just to talk about the, I guess the sort of people that you would sort of have come through, and the reasons, I think, sort of behind why they're becoming in. I mean, everyone's been on that corner of the internet where it's penis pills, take these for 30 days, or and then at the other end of that you've got very sort of temporary penis pumps and stuff like that you sell in sex stores and things like that. But so people are coming to you, I imagine, for great range of reasons, and starting from small to medium, and wanting to be huge, or wanting just to be normal for confidence reasons, all that kind of stuff. Can you take us through some of what you see and those reasons people?
So first of all, I'm going to tell you that the majority of the men that come see us have an average to above average size penis, which it's really hard to believe that's the truth. And so I feel like most men want to increase the size of their penis. They may not want to admit it, but if they had a safe way to do it that they knew was going to be undetectable and aesthetically appealing, I think that most men would make the size of their penis larger if they could. And so a lot of the times the penises are not below average. I've actually never treated a true micro penis, and I've never had a true micro penis come into my clinic and ask to be treated. And I don't think that any of our providers ever have as well. So these are regular guys, and the reason that they come in could be because their wife had 3 vaginal birth deliveries, 3 children through the vaginal canal, and sex doesn't feel the same because he's not touching her walls of her vagina like he did before. Maybe it's the guy whose girlfriend or boyfriend made a comment in a fight and called them, words that said that they had a small penis. Or maybe it's just a person who always thought, since they were playing Little League football, that their penis was smaller compared to the other guys in the room, and they just want to do it for their own self-confidence. So there's so many reasons that people want to do it, but I see it from self-confidence, from being able to walk around the gym and feel better about themselves in the locker room, all the way to trying to make their wives feel better during sex after they've given birth to their children. So there's a lot of reasons out there, but the only ones that I think are not healthy is when someone has what we call true body dysmorphia or penile body dysmorphia, where they actually have a large penis and they perceive it as being small. I mean, if you come into me and you have a large penis and you know that your penis is large and you just want it larger, go for it. I think that's great. But if you come into me and your penis is large and you see it as really small, I'm never going to be able to fix that for that person. And so those are the patients that we try to not really get involved in. So we try and weed those out in the beginning.
Yeah, it's interesting. I was sort of wondering, since maybe when you started this or even started in this field, if you've seen a sort of change in what people are and reasons people are coming in. What I wondered is if you hear a certain amount of sort of trends and influences socially from maybe pornography and stuff like that, and some of the impacts that might have on women and their own sort of body appearance and the labiaplasty surgeries and stuff like that. I wondered if you sort of seen a bit of a rise in, I don't know, self-confidence issues in blokes or anything like that?
That's actually an interesting. I haven't really laid this out like you just put it, but when I think about the majority of my men that are older, they seem to be coming in because they're trying to fulfill their wives. Or maybe they're going through a divorce and this is the right time to be able to do it before the next person sees it. I get a lot of guys that are going through divorces and they're like, this is the time I'm going to do it. My next person's going to think I've always had a big penis. And then I see a lot of times the guys that are in their 20s and in their 30s, those guys grew up with pornography. I'm 50 years old. I didn't grow up with pornography. So I was never comparing my penis to the absolute best creme of the creme penises that were being videoed in pornography. But now, like, I know that I speak to people and they tell me that they started watching pornography on their phones when they were 10 years old. I personally can't even imagine what it would have been like for me to have had pornography at the age of 10, but and to have private folders on your phone where you stored it. I mean, like, I hear the stories that I hear from the younger guys, so they have been put into a position that I wasn't put into by being exposed to pornography at a very young age. And I've done an interview with like a pornography producer or an adult film, someone who casts, and and they've talked to me about what they look for and how they don't take mediocre penises and the level that the perfection that the penis has to be before it makes it to pornography. And so a heterosexual guy that's never seen another penis besides his own penis in his entire life only knows how to compare it to what he sees on TV. So I think it has made a big difference in the perception of people, which has probably changed their confidence a bit.
I'd love to just even anecdotally, some of the the sort of success stories that, I'm sure you've heard about your procedure and how it's, has changed people, in terms of, confidence, happiness, those sorts of things.
I have a good one that I haven't shared with anyone yet. It just came across my desk just the past couple of days. I have a man that flew in to see me. He heard us on another big podcast, flew in from out of state. He wanted to see me specifically, and he told me during his consultation that many times in his adult life, women had gone out on dates with him where they had had 1 to 2, maybe 2 to 3 dates where things were going really well, and then they get into the bedroom, and he said that he could think of at least 10 to 15 times that women had just gotten up directly out of bed and left because his penis was so thin. Yeah. He had some length, but it was so thin. And women like the girth. Yeah. Sexual partners like the girth, whether it be a man or a woman, they like the girth. That's what is satisfying. We know that from studies from both sexes. Yeah. So he had, in his case, women walked away from the bedroom because of the size of his penis. And so he said, I can't go through it any longer. I can't live through this again. He said, I can't have one more person get up and walk away from me. So I've just started telling women on the first date, I have a really small penis, and if they want to continue moving forward, then we do, but generally they don't. And he said, which is also hard, but at least it's not that you have opened yourself up and taken your clothes off and you're in a bed when it happens. At least it's a little bit more refined. And so he has had a few treatments with us. I think he's probably had 4. And so we gain about 1/4 of an inch. I'm not sure what that would be in centimeters, but about 1/4 of an inch increase in girth every time the patient comes in. And so after 4 sessions, he's about an inch increase in girth. And he just messaged me, and I was happy to have this cancellation. He just messaged me and asked to cancel his next appointment because his girl that he's currently dating, they have an amazing relationship, and they're completely fulfilled in their sex life. And she told him that it was big enough for her and that she was happy, and now he's happy. And so that was one of the best sex stories, one of the best stories that has saved someone's sex life. I have another story that comes to mind, and I actually treated this guy today. He and his wife were on Reddit, and they were looking into the chat rooms where you find, I guess, bulls, like This Is Dallas. So he was into the Dallas chat rooms, I guess. Yeah. Looking for a bull, I'm sure that you know what that is, to come in and have sex with your wife, to try and sexually fulfill your wife because you're not able to do it yourself. And he said that it really had destroyed their relationship because she had fallen in love with one of the guys that he was bringing in to fulfill her sexual needs, because he did not have the size to be able to do it. It was just not going to happen with him. And I think that she probably could have been a little bit more sensitive to the situation from what I've heard from him as well. But anyway, he was trying to fulfill her needs and put his own feelings above hers, and she fell in love, and they actually were separated, and they were about to have a divorce, and he found PhalloFILL, and now they have a very happy sex life. They're no longer on the social apps trying to find people to come in to fulfill that sexual need. So I mean, I have a lot of them. I mean, and there's so many different types, there's so many different situations that we have, but there'd be surprised. I mean, I've even had a lady call in and purchase girth enhancement package for her husband and for her son at the same time, because she knew that it had been a problem for her son as well as her husband, and so she just got the whole family treated. I love it.
That's what we, that's kind of what we're talking about. That's a frank family conversation at the dinner table, isn't it?
Yeah, so get ready to have it with your children whenever it's time.
Oh, you'd unwrap a voucher for that around the Christmas tree or something like that. It feels to me like a real world health benefit, that improvement of confidence and sexual confidence and stuff like that. It doesn't feel just like, oh, I want a bigger penis because it'll look great in my gym shorts or whatever. It sort of has different knock-on effects, and it is interesting in that context of body positivity and people should be happy with, their bodies, and some people are, and some people are. The other sort of side to that is people can do with their bodies whatever they want as well, and should, be able to, whether they want to, dye their pubes green or whatever it might be. So I like that's what interests me, and is the real, it's just those real benefits that some people can have from that, and it's not a pure vanity thing. I don't know, it sort of feels different to just like, I want bigger because, you know what I mean? It's does that sort of ring true?
Well, I was gonna let you finish. I was gonna comment that I've been on a couple of podcasts with sex therapists, and then they've talked to me about treating patients for 20 years and never making any headway with them when it comes to the size of their penis at all. Zero. Because they've told me there's just nothing that I can really do in a therapy session to correct this. I've tried to correct this for years. And if a man gets out of the bed, goes to the shower, and sees himself in the mirror in the morning with a small penis, it puts a dark cloud over his head, and he continues the entire day with this dark cloud over his head, and everything that he thinks about a lot of times is going to be guided from the way that he felt about himself in the morning. And so I've had men that have been entrepreneurs that had told me that they had been stagnant for years, and all of a sudden now they have big dick energy, and they're starting new companies, and they're developing new products, and people are getting, people are dating on higher tiers on Tinder, and they have more self-confidence walking up to people, even if it's not a sexual relationship, if it's just a one-on-one, relationship with in a social setting. When you have more confidence, you carry yourself in a different way, and people perceive you in a different way. And so I think it really can be life-changing for someone who has had this in their head for years, that they're not the man that they think that they should be because of the size of their penis. And it's unfortunate and it's sad, but it is. And so now we have a way to correct it safely and to make it look good. Yeah,
no, that's wonderful. I think, the fact that sex therapists are sort of drawing a blank, it just speaks to the fact that everybody's different. You know what I mean? Some people might be able to work around any issues that they might have with their penis size in a different way. But for some people, this is a great solution. In terms of the other stuff, I did. It's piqued my curiosity really, but the sort of biohacking stuff that is also mentioned on the AdvancedYOU. Can we just have a little just to sort of satisfy my curiosity on what exactly that is, and also, I guess you have your ear to the ground. What's coming up for us in the next sort of 5-10 years in this sort of space? Like what's going on?
I'm going to disappoint you on that question, because I am so focused on what's coming out in the penis, and so I'm so focused on what the next steps are going to be to get more girth enhancement to the masses right now, that I really am not quite as tuned in to the biohacking future as what I probably should be, but I can very well tell you what's going on in it right now. So I have a biohacking clinic, as you just mentioned, in Dallas. And so we focus on modalities that you can't replicate in your home or in your regular gym. So things that make you look better, feel better, and perform better. When you put all those things together, the idea is that you may live longer, but the true idea here is that you're going to have more life in your years, and maybe you get more years in your life. If that's sort of a good term for you. So some of the example of what I have a hyperbaric oxygen chamber. So that's what you put a diver in whenever they come up too fast when they're scuba diving. But it also has tremendous anti-aging and longevity benefits. So if you're familiar with telomeres, which is the end caps of your DNA that determine how long your cells can live, which have to do with how many times they've replicated. But we're able to lengthen telomeres with hyperbaric oxygen sessions. We're able to increase the density of your mitochondria, which is the production houses of your ATP, which provides all the energy for your body with a hyperbaric oxygen chamber. We're also able to reduce inflammation and increase collagen production and heal wounds and heal tendons. And there's just all kinds of things that happen when you're breathing in 95 to 100% oxygen under pressure. And it's generally about 60 feet or so. My chamber is about 60 feet or so under sea level pressure.
Yep.
But it basically liquefies this oxygen in your body, and it forces it into all of your hypoxic tissues. So even into your penis. It's a great treatment for men who want to maintain their erectile function. Yeah. So we're forcing oxygen and creating vascularization in the penis, but also even in the hair in your head. So people have better hair results from a hair transplant if they're having hyperbaric oxygen sessions. Jay Leno, one of our comedians from here from the U.S., had a big explosion when he was working on his car, and his face was burned, and they used hyperbaric oxygen therapy to heal the skin on his face. So it's got great potential for many factors for anti-aging, longevity, biohacking. But I also have things like a meditation bed that can put your brain into a theta meditative state. It's very hard for someone to learn how to get into a meditative state. Get into theta brain, it's hard. It takes people years of training to get there. But we have a bed that's got 5 different wavelengths of vibration that work with sound therapy. And so we know what ohms the frequency is going to be of the music, and it works with the bed. And so it basically encapsulates you in music, but it's designed to hit particular parts of your brain. So you can choose a soundtrack that's dedicated to anxiety, and there's 5 sessions of that particular track, or one that's for depression or dementia or for addiction. So, or if you just want to go into theta and just get your head out of your daily activities because you can't stop thinking about work, or you can't stop thinking about your children, or whatever that may be, we can put you on the bed, give you 30 minutes inside there, you come out rejuvenated. I've got some amazing exercise equipment that uses, it's called adaptive resistance training. And so it properly loads your muscles through your entire range of motion, as opposed to when you're lifting a 25-pound dumbbell on a bicep curl, you're not the same strength through your entire range of motion. So you may be weaker at one point and stronger at another point, but you're only able to use one set of weights, or you're only able to use one weight at a time. And so my exercise equipment changes its strength all the way through the range of motion based on what your actual strength is. So it has sensors that recognize what you can do. It's amazing. It cuts your workout down and into minutes rather than an hour, but it properly loads your muscles, and you feel like you had your butt kicked whenever you get finished. And then I've got things like cryotherapy, and I've got exercise with 95% oxygen, so you can do your cardiovascular on my exercise bike with 95% oxygen. We've got what's called M-Sculpt, which is muscle sculpting. It does magnetic muscle contractions. We can do your abdomen, we can do your flanks, or your lower back, we can do your buttocks, and we're basically doing 25,000 muscle contractions. So we can keep someone's core strength strong when they can't necessarily do a crunch. So I've just got a lot of things like that just make your body healthier than you can do on your own. And then we offer, we have a metabolic test where you're doing a resting and an exercise metabolic test. I can tell you exactly how many carbohydrates, fats, and proteins you burn at rest and as your heart increases through your exercise. So maybe you're a marathon runner and you think that you need to carry glucose with you because you need glucose in your run. Maybe you function where you need more protein when your heart is between a certain beats per minute. And so we can find all these things out for people to help them have a healthier life through metabolism, through weight loss. And there's just so many parameters that we can look at.
Yeah, amazing. Oh, that sounds great. Oh, the running thing really piqued my interest there. Because there's a lot of guesswork when it comes to
you should find the test. Find a metabolic test, and they should do a resting, and then they should do an active where you get all the way up to your VO2 max, and then you'll also get you find out what your VO2 max is as well.
Amazing. Oh, that sounds really great. Hey, that's amazing. I think how can people find you
Well,
where can people find you?
come to our website. So it's PhalloFILL, PHALLOFILL.com. And one of the things that I love about how my company has been set up is that it's really hard for a guy to pick up the phone and call and not know who's going to answer the phone call on the other side. Generally, at a front desk, it's going to be a female. And so you're having to ask questions about your penis to a female who you don't know who it is. And most times, someone at a front desk that's having to answer phone calls for all other kinds of services don't specifically know how to answer the questions about girth enhancement. So on the website, you'll find a way to text us, send us a text message directly. And we're going to respond back to that text message with a live person. We don't have any bots, we don't have any AI. And all the people who work on my team have actually had the procedure. And so you're going to be speaking to a guy that's had the girth enhancement procedure, and they only answer questions about girth enhancement. You can ask a question today and then forget about it for 3 weeks, do some research, come back and ask another question. Sometimes we nurture these guys through this process for a year and a half before they decide to get treated, but that we're always there for them whenever they get ready. We have people working 7 days a week, almost around the clock, answering questions. And so generally you're always going to get a response, and it's going to be someone that specifically answers questions for girth enhancement. So all that's on our website. You can also see some great before and after shots. We've got about a gallery of 60 or more of before and after photos on there. We've got a form that you can fill out to find out if you're a candidate, and FYI, you're all a candidate. The only ones who would not be a candidate would be if you had some type of reconstructive surgery on your penis, or you had some type of bleeding disorder, but most everyone's going to be a candidate for PhalloFILL girth enhancement.
Amazing. Cool. All right. And it sounds like you also do gift vouchers that wives can purchase for their husbands.
Well, they call in, so
sure,
we'll send them a gift voucher. We'll send them a sausage with the PhalloFILL logo on it or something like that.
Amazing. Hey, thanks very much for your time. Good luck with everything. Thanks heaps. Thanks.
Thank you, Tim, for having me on your show. I really have enjoyed it.
Really hope you enjoyed today's episode. Before we sign off, we wanted to ask you again for your help. Because we talk about sex, we keep getting shut up across a lot of social media platforms. And this not only makes it hard for us to be found, but it says that sex is not okay to talk about. Not only is sex okay to talk about, it is totally essential, because the more knowledge equals better outcomes for a whole bunch of measures for all of us. You can make a difference. And the thing we need from you is your active support. So please follow the podcast and sign up to our socials: Instagram, TikTok, YouTube, whichever you like. You can find us over at sexandspace.com and click on our social links from there. Help make sex an okay space. Thanks for taking this trip with us. Until next time, safe travels, and we'll see you on the next episode.